If you are suffering from anxiety, stop scrolling. There are 5 things that you're going to make sure your nutrients are proper levels of. The first is vitamin D and vitamin K. You want to make sure that your vitamin D and K2 are adequate, especially if you are in a state that does not have a lot of sun. You may not be getting adequate levels. Make sure you're getting D3 and K2. Second thing, our minerals and nutrients are a low zinc and a high copper. You can measure these in serum testing. You want to make sure you're getting RBC and looking at copper levels as well as ceruloplasmin. Low zinc, high copper can contribute to anxiety. The third thing is magnesium. Low magnesium has been associated with anxiety and depression, and it's essential for over 400 processes in your body. You can test this as an RBC magnesium, but you're probably fine to just go ahead and start taking that at night. Fourth thing to consider are your omega-3 fatty acids, especially if you're not a big fish lover and you don't eat a lot of algae supplements. So EPA and DHA are the 2 types that we hear a lot about as far as omega-3 fatty acids. DHA specifically is really good for the brain, really good, especially if you're a teen that has having some suicide ideation. One of the first things we do is give them DHA. And the last nutrient that I always make sure patients have if they're suffering from anxiety or depression is B complex. There is a host of things that you need to be able to make your neurotransmitters, serotonin, dopamine, epinephrine. Those enzymes need B vitamins, B6, B12, sometimes B9 as folate as well. So sometimes the B complex could be something that can also help these symptoms. If you're having more hormonally related issues, follow for more tips.